Hello, everybody. Zach, couples physical therapist here. And folks, have you ever worked with someone who's very restricted in all directions, and maybe they're the classic over-tucker or sway-back person, and you're like, man, I think I see what's going on, but I'm not sure. And the other issue is I don't know what I should be coaching this person to help them move betta so they can reach their fitness goals. Well, folks, I'm going to solve that problem for you today because we're going to take a look at one of my dear clients and friends, Andy McCloy. Check him out, Andy McCloy _BCI. And we're going to go through some before and afters with what we're doing with him from a movement perspective, what types of findings I'm seeing that would indicate me programming these exercises, and how I'm going to coach this wonderful human being to help him increase his movement capabilities, get him closer to his fitness goals so no one will mess with him. And then hopefully you can learn the same for your clients so they won't mess with them either. Ain't nobody messing with nobody today, but let's go ahead and we'll check it out and see what we're doing with our boy, Andy. I'm going to give you a brief overview of Andy's story. Andy has been in the industry for some time as a strength conditioning coach and business owner. He's got a long training history, so has lifted a lot of heavy weights and also has some combat capabilities. And unfortunately, a couple of years ago, Andy had to undergo total hip replacement bilaterally, both hips, just because of significant changes within the bone, overall movement restrictions. Andy wanted to take care of his health at this point in time, wanted to make sure that his training wasn't counterproductive to being able to increase available movement, among other things. And so he reached out to me to help him. What I'm going to show you next is we'll look at his remote assessment that I did, the test results, and we can come to some conclusions based on this and in terms of why he's presenting in this way. So here's Andy's test results right here, and I'll just go ahead and give you a second to take a look at it. But I want to point out a couple different things that I think are fairly important. So the first is he's a wide infrasternal angle, which that's a build for force production here with someone who presents like that. And if you're unfamiliar with infrasternal angles and things like that, just check out zachcouples.com, type in infrasternal angles, and you'll be able to find a bunch of stuff on that. But with this type of ribcage presentation, we would expect increased internal rotation capabilities and decreased external rotation capabilities. But let's see what happens when we look at hip and shoulder rotation. Check out that, folks. Well, it appears in the hips and the shoulders, he has more available external rotation than internal. But, caveat to that, look at the overall decrease in rotation in general that we're seeing with Andy. In the hips, he's got more external than internal, but in the hips, we would expect or hope for a total arc of rotation of about 100 degrees, 60 degrees of external, 40 degrees of internal. Here, we can see that Andy has about 30 degrees total, with more external available than internal. Conversely, in the shoulders, we would expect 160 to 180 degrees for a total arc of rotation, 90 ER, 90 to 70 IR. Look at Andy. Andy has about 65 degrees of total rotation, which is quite a bit less. More biased towards external than internal. So then how is this happening, Zach? Andy should have more internal rotation capabilities than external, yet we see a reverse of that and an overall decrease in motion. Chances are Andy is doing some type of secondary compensatory strategy. Let's dive into the numbers again just to tease out what that could be. Straight leg raise is about 60 degrees, which is a bit more than you think you would anticipate given the deficits in range of motion that are occurring. Normal straight leg raise is between 70 to 90. His is almost normal. The other thing that stands out is Andy's toe touch is full, meaning he's able to touch his toes with his knees locked out. But here's the interesting thing, folks. How do I have so much more toe touch and straight leg raise capabilities, but the issue that I'm seeing is I don't have the same availability in the hips and the shoulders? Well, a lot of times when you see that, if I don't have the available range of motion in the shoulders, which is correlated towards more thorax mobility, And if I don't have the available motion in the hips, which is going to associate with basically lumbopelvic mechanics, where Andy is likely picking up range of motion is through the spine, meaning he probably has some bending capabilities in the spine that allow him to orient everything together to give him the appearance of more motion than he actually has. This is especially the case with the toe touch and the straight leg raise. Those are the tripwires that let you know, that's probably where Andy's cheating. And it's also not uncommon for Andy to have occasional back pain. Now, of course, we can't say that the biomechanical issues are the reason why Andy has back pain, but you could see how perhaps if he has more available ability to move through those areas, they might get loaded more so than some of the areas where he's restricted. Let's see if we can tease out what's going on here. So, Andy has a wide ISA, which you would expect to have increased internal rotation capabilities and decreased external rotation capabilities. Yet, what Andy has is decreased ER and decreased IR, but the IR is more so decreased than the external rotation. So we have a flip-flop. And the other thing that we notice is likely something is going on at the spine to allow him to pick up more motion than he has. That strategy, folks, is a sway back orientation. So let's break this down in terms of how Andy is picking up the external rotation. Given that Andy is a wide infrasternal angle, that's going to be more associated with a nutated or forward-tipped sacrum. This position allows Andy to pick up more internal rotation at the hips. But since he's not presenting that way, he's got to find a different strategy to create external rotation at the femurs. And so what he does is he pushes the hips forward, and as the hips push forward, the femurs are allowed to attain an externally rotated position. This allows Andy to pick up more ER and drop off IR. But it also comes at a cost, because I am going to lose some external rotation capabilities along with this, because this is a compensatory strategy. I have, along with this forward push, increased anterior and posterior muscle activity that's going to steal full rotation capabilities of the pelvis. This is why the external rotation measures are also dropped off. Sometimes when you don't have that anterior and posterior compressive or concentric strategy, you can have someone who gets the forward push and they actually might have what appears to be full external rotation. This isn't the case with Andy. So what Andy's done is he's squeezed the front and the back of the pelvis to flatten it. That reduces his rotational capabilities, which we'll see in some of his activities. And then because he's got available motion through the spine, he's able to push the pelvis forward by essentially doing this. And you're going to see this a bunch when we watch Andy move. Now, the interesting thing, in the thorax, we're seeing a very similar strategy. A lot of times when someone has that sway back orientation, you'll see rectus abdominis increase muscle activity, and it'll pull the sternum downward. When that happens, you actually have an increase in available internal rotation, but you have a decrease of external rotation. We're not seeing that with Andy. In fact, we're seeing a mirroring effect of what's going on in the pelvis. Namely, Andy has a drop off of total rotation, slight bias towards external. The way Andy's doing that is the exact same strategy. So he's squeezing or having increased muscle activity anteriorly and posteriorly, and then the thorax is going to translate forward. That changes the orientation of the humeri to give him a little bit more external rotation, but not full, because of the anterior and posterior compressive strategy. And so to recap, the big strategy that Andy is utilizing is we have A to P compression, right, or concentric activity. meaning front side and back side stuff is really active. And the other thing is thorax and pelvis are pushing forward or translating forward in space. And these are how Andy can have these particular presentations, along with the increased toe touch and increased SLR. Andy's picking that up by moving through the spine. You can see an example of this strategy right here when Andy does med ball throws. So if I go ahead and play this, boom, you see he doesn't get much turn through the hips. A lot of this is occurring through the axial skeleton. I'm going to play that in a little slower motion. So here, right? So normally we would want to see the hips push back a little bit more. You don't see much of that. And then you can see how Andy gets a little bit of rounding right through here where my cursor is. And that allows him to get the rotational action. And you can just see not much of it's happening through the hips per se. And the way that you know that on the catch portion of this move, so if I go ahead and play it in full, boom, look at the front knee position. If Andy was getting a little bit more movement through the hips, we would likely see a slightly more positive shin angle. Here he's staying fairly vertical. The more vertical I am, the more internal rotation I can drive through the extremities, which is going to lock the rotational capabilities throughout the spine, or throughout the pelvis, I should say. And then he's going to pick it up more so through the spine. Here's another example of this right here, and these are things that we've been working on. But when you watch Andy do a pull down and set up, you can see just how rounded Andy is right here. That's allowing him to get into the position that I'm asking him to, because when he's in this staggered position, there's a little bit more of a demand for external rotation, which he doesn't have much. And so the way Andy picks that up is by rounding through the back like this, because now it changes the orientation of the acetabulum to get him into a position where he can get external rotation. It's just the problem is he's not getting the relative motion available as he does that. The other thing you're seeing too right there, you can see how Andy has a tendency to look down. Same song and dance. That's just allowing him to round through the spine to pick up external rotation. And so what do? Andy just screwed, or should we just say, oh, go ahead, that's just the way, Andy, you move. Go ahead and do what you do, big dog. Nah, that isn't how we're going to approach this today for Andy, because training at the level that he wants to was problematic. So we have to change the movement strategy in order to get him into a position where we can increase his available movement, which is going to give him a larger training menu to choose from. So conceptually, the solutions when you see someone like this are as follows. The first thing we have to do is we have to teach him to push the hips back to get him out of that forwardly translated orientation. So what I mean by that is if Andy has a tendency to push the hips forward during moves, and that creates that excessive rounding through the spine, we got to teach Andy to pull the hips back slightly. So instead of having the femurs in line with the ischium or the bottom of the pelvis, he needs to learn to push the hips back so the ischium or the bottom of the pelvis is behind the femurs. From here, then we actually have to get him external rotation. So the way that we'll do that is by driving vertical pelvic displacement with things such as squats, step-ups, split squat variations, and the like. Not much hinging, because if he hinges, what's going to happen is we're going to drive more internal rotation, which we want to generally have more external rotation before we go after internal rotation. And that's because when you're talking about moving the extremities, generally external rotation occurs before you internally rotate. So we got to get him to push hips back plus vertical pelvic displacement. The other thing that we're going to coach Andy big time is we want everything to be low tension. In Andy's case, because he is reduced range of motion wise everywhere, there's increased muscle activity at rest. That limits his rotational capabilities, and that's why we see an overall deficit in Andy's ability to externally and internally rotate. So we want to minimize tension during a lot of the moves. So that's coaching him to kind of be lazy, be flowy during, especially the eccentric phases. But the other thing that we have to focus on, and this was actually a huge cue for Andy, is I don't want a tuck and I don't want ribs down. So with some of the moves, Andy was really tucking. When Andy does the tuck, all he does is he reinforces that forward pushing strategy because the glutes have a little bit more bias towards increased muscle activity. So when the glutes are a little bit more active at rest, that just pushes the hips a little more forward. When he exhaled, he was doing so forcefully, and he was aggressively orienting the ribcage downward like this, as opposed to getting the ribcage to expand in all directions and get smaller in all directions. This is one reason why I think the ribs down cue is not very effective, because what ends up happening is you don't get a change in the expansion capabilities of the ribcage. You just hold the ribcage in place and you literally just change the orientation. You see how if I like breathe in and breathe out, the dimensions of the ribs change? Whereas if I hold the ribs right here and I just tip it down, I can move where the ribcage is located without getting that dimension change that we want. And, you know, I'm guilty of making this mistake in the past, but it's folks who present similar to Andy that helped me realize that, oh, this is not useful, and this is the reason why it's not useful. Because you're just changing the orientation or the location of the bones, not necessarily restoring the intersegmental or relative motion that they need. So if we can get Andy to demonstrate these things, no one's going to mess with him. Now let's go over a few good examples of when we're seeing this with Andy in terms of what we want. So remember, as I had mentioned before, folks, we want Andy to be able to push the hips back, plus vertical movement, right? And so when you look at Andy doing this alternating row here, which I'll play in slow motion, you can see, well, a couple things. One, Andy's back is actually a little bit more on the flat side, which I like. He's moving the hips backwards, which is good. Head's in a good position. You're not seeing that increased rounding that we saw previously. It's actually not too shabby. So we'll just go ahead and play Andy there. But like that's what I want right there. Here, he's got the ischium behind the femurs. That's the relationship that we want to have. So this position right here is actually a good way to encourage Andy to be able to do that. Let's now see what this looks like with a lower body move. So here I have Andy doing a bent over or kind of hinged step up. And so you can see again right here, Andy's back is kind of nice and flat, which I want. Look at the relationship of where his hips are in relationship to his femurs, right? He's got that ischium behind him right here. Whoop, nope, not wrong button. There we go. Ischium right here, femur in front. And then when you see Andy go up in this, he does a really good job of maintaining that position. I'll go ahead and play that again. Right there. He's not too shabby. The thing I don't like is the head's coming down, so I would cue him to bring his head up a little bit. But otherwise, like, this is pretty solid right here. Now, I'm going to give you some examples of when Andy struggles with this. Here's Andy doing a Zercher squat. And so the Zercher squat, well, a couple things on this. One, and this is partly my bad, but you'll notice that I got Andy on a ramp. That's going to allow him to get some vertical displacement, but if Andy has a tendency to overtuck, that actually could magnify the overtucking. The other thing that stands out is the Zercher position, because it's at about 0 to 60 degrees of shoulder flexion, that might promote posterior expansion, but the other issue could be that Andy could end up crunching with this. So let's play this through and see what happens. Okay. Now, I'm going to do it again, but I want you to go ahead and just focus right on this area right here. And notice how Andy gets down into position. Right there. Right? So in my mind, you can kind of see a lot of rounding happening through the spine when you go ahead and like flash back to what we saw with the step up, right? In the step up case, the spine was much flatter. Here, it's getting a little bit more rounded, which is undesirable because I want more of that pushed back position. So I made Andy aware of this. I told him, hey, my G, we need you to push the hips back, then go down. And in fact, that's one reason why I had him doing the box squat. And once he did that, actually cleaned up nicely. So here's the after of Andy. And watch this. Boom, look at that right there. Do you see the difference, folks? And I'll do a side-by-side comparison. But look at the spine position here. Like that's flat as can be, which I like. That's going to allow us to get the hips to come back. Boom. That looks pretty dang good right there. And he gets it again. The other issue that we had to fix, which I missed it actually right here, you can see Andy at the finish kind of pushes the hips a little bit forward, but that's okay. Like when I see this right here in comparison to what we had previously, I am ecstatic. In fact, I'm going to show you that in this next picture right here in this comparison. Here we got those same two squats side by side. Look at the position Andy's in there. So this was the before, and this was after we coached it. Right there. Do you see the difference, folks? See how he's getting so much more rounding here? But then by simply, now he's still got a little bit at the bottom, but you just look at the position of the spine right where my cursor is versus on this side right here. It's a way better orientation in my opinion. And that's probably even better. Just look at, you see he's a little bit more upright here on the bottom of the squat here, and we still kept the ramp. He's hinged slightly forward. That's encouraging Andy to be able to get the hips back. So it's well within Andy's control. You just have to give him a little bit of cueing. And this is true with everyone. This is why it's important just to learn effective cues. And by doing so, you're going to get some nice movement improvements, and these can happen very quickly. Like this did not take long. It was literally just a couple things. Folks, even though I say in this case of the squat, it was easy peasy, just had to say a couple things. In other moves, we had a little bit more of a difficult time getting the positioning that we want, and it's still a work in progress. And so you might not always get a quick change right away, and I will show you that as well. But that's where you just keep hammering. You find different ways to coach and cue someone, and eventually you'll get much closer to where you're looking at. One of the biggest cues that I use, especially remote, is I demo a lot. And so when I send Andy a video, I use what I call the good, bad, good sandwich. So just like if you're giving someone feedback, you say, hey, you're doing awesome with this. I need you to work on this, but this is good. We kind of do the same thing coaching-wise. And so what I did in Andy's case was I said, hey, here's what I want. And I demonstrated push the hips back, drop down. I say that. I show Andy what he's doing. Usually that's by me doing an exaggerated version of what he's doing. So you got to be able to move your body. And then what I do is I show him again what I want. And the example of this before and after in the squat is one way that you can see how that works in action. Another example of which we can see some of this difficulty is if we're doing a pure hinge-like exercise. So I'm going to show you this video of Andy right here. And here he's doing a kind of an offset RDL to cheek clean. This was something that we tried initially. I tried to coach him through it a few times, and we eventually abandoned moves like this just because it wasn't feeling good for Andy. And I think the error that I made when giving Andy this was we should have emphasized a lot more push the hips back, go vertical, and maximize the amount of external rotation that he has available before going after something that's going to drive a little bit more internal rotation. So you can see right here, I want you to look at Andy's back and how much his hips move backwards as he performs that activity. So we'll go ahead and run through that again. Right there. And so what we should see, folks, is we should see the hips travel backwards And then once the hips stop traveling backwards, we shouldn't see any rounding occur through the spine. But when you watch Andy do this, so right about there is when the hips stop traveling backwards, right? See how we're not really getting much, we're getting a little backward movement, but that's really when it slows down. But then watch what happens to Andy's torso position. See how he gets lower? He starts moving downward like this. So that's Andy creating that rounding through the spine that we saw in the squat. But it's just instead of it happening as the hips move more vertically, it's happening as the hips move more horizontally, or at least they should. Now, if we contrast that with a different version of Andy after coaching him through this, we can see it's a little different in this version right here. Check that out. Boom. So I'm going to play that again, but just watch how much Andy's hips move back. So it keeps going, keeps going, keeps going, keeps going. Right there's about when it stops. And you'll see that that's as soon as Andy starts to transition into the cheek clean. Right about there. So as soon as the hips stop traveling back, we don't have that rounding anymore. And then Andy's able to explode out of position. That's what I want to see on a hinge. Because now what's going to happen is Andy's going to increase space in his pelvis. That's going to help us recapture some range of motion. We're not going to get that compensatory strategy through the spine. Again, let's check out the side-by-side comparison of these. I'm just going to get you into position. Compare that right there. So that's Andy's end hinge range versus this right here. To me, that's a lot smoother. And then when I take Andy kind of through his final form, it looks like he's got way more pushback through the hips. The knees are nice and soft. He's not getting that rounding action, which we kind of see right here through the spine. Now, the other issue, and this has been the most difficult, has been trying to apply that push the hips back, drop down concept through the split squat. Let's take a look at the split squat on the screen right here. So I'm going to go ahead and play through this nice and slow. And I want you to look at Andy's spine position right there. All right. What do you notice? Well, folks, in my mind, looks like my boy Andy is quite a bit rounded right here as he goes down. See that right there? And you can also see how the knee comes a little bit more forward as Andy comes up. And look at it right there. That's a lot of rounding happening through this area at the bottom. And with this particular squat variation, the superhero split squat, which if you really want to learn how to apply and coach this, we talk about this variation at Human Matrix, my seminar. If you're watching this in 2022, we have 3 of them, and the link will be in the description below to attend. May 7th and 8th in Buffalo, New York. May 28th and 29th is in Seattle, Washington. And August 6th and 7th is in Boston, Massachusetts. Go ahead, sign up, link in the description below. But when you look at this, you'll notice that he's getting a lot of rounding when ideally we want to see that flat position like we saw in the squat and eventually the hinge. But because this is single leg, it's much harder for Andy to do that. But when I have Andy do an iso hold, it's actually a lot better. Check out this variation, folks. So you can see right here where the cursor is, that's much closer to the position that I want Andy to be in when he's holding position. You can see that we're getting some nice straightening through the spine right here. The hips are traveling backwards. It's not perfect, I'll admit. Andy's still getting a little bit of roundedness right through here, but it's much better. The hips are much higher. If Andy could maintain this position and then move the knee down, I think he would get absolutely destroyed on this move. And even when Andy made just this little tweak, he gave me some feedback, and I think this was in his stories, or in his reel, I should say, that he had way more glute and hamstring. And when you're doing this superhero split squat, that's what you want with this. If I can get Andy to do this, like it's going to open up a tremendous amount of motion. Here's a side-by-side comparison of this move. Just look at the position of his spine on the left. So that was the early version compared to where we have him here. Again, still a little bit of rounding, but this is much nicer. You notice how his torso is much more vertical in the left, but he's not ready for that yet because we have to teach him to push his hips back first. Here, now he's pushing his hips back and he has a much better spine position. The other time we can see this strategy manifest is when Andy's in half kneeling. And I'll also show you just how different the rotation is in the upper thorax with each of these moves. We're now going to look at Andy doing a half kneeling pull down. So here we got Andy doing the pull down. I'm going to go ahead and play that in slow motion right there. I want you to pay attention to what his arms are doing. And then I'm going to see if we can just take a look at, like right there, look at the spine. Okay, so let's look at that first. You'll notice that in this particular variation, we kind of have a similar strategy that we've seen before. A little bit of roundedness through the spine here. And that's because Andy's has a difficult time based on his restrictions, keeping it vertical so he gets the movement where he has it, which is lumbar spine. The other thing that you'll notice is as Andy's doing the pull down, you can see how the humerus is in a lot of extension. That's because of reduced rotation through the thorax. Andy can't get the shoulder blade to slide along the back and along the front as he performs the move. And so what happens is he just tips the thorax slightly forward and the scapula forward to try to get some rotation. But with a little time, a little bit of coaching, and a little bit of an awareness of what some of these compensatory strategies, Andy's able to make a difference on this pretty quick. Folks, check out the positioning here. This is baller status. First, and just look at the still. Look at the difference in Andy's torso position here. See how much flatter that is? See how we're not getting that rounding that we had previously? Again, that's just with a little bit of coaching and cueing and having Andy recognize that this is what you're doing with this particular strategy. So that's really nice. The other thing that we'll see is watch what happens with his arm as he does the pull down. What's gone? Well, I'll tell you what's gone, big fam, that humeral extension. So now Andy is finishing with the arm right here as opposed to right here where we saw previously. And the way Andy's doing that is because he's now gliding the shoulder blade along the thorax, because we've also done some other stuff to help him increase his available range of motion. And here's the side-by-side comparison of these two. You can see, just look at the start position, right? Andy's really rounded on the left, less so on the right. And then when you look at the pull-down finish, boom, look at that. Humerus really extending, scapula moving a little bit more anterior, but then when he does it right there, we're not getting that as much. Now we're actually getting the shoulder blade to glide backwards, and my man is getting mega gains, both with muscles working and from a mobility perspective. We've talked a lot about pushing the hips back and then moving it up and down. One thing we haven't discussed much, though, with Andy's case is teaching him to move with overall less tension. If we can get this, then we might allow for some more rotation to happen. And what I want to show you next is some examples of when Andy is creating a lot of tension and move versus not. The most notable time that I've seen this with Andy is during an overhead press. Here we got Andy's overhead press. And so what I'm actually having him do is a push press with a head turn. My hope is that the head turn, which is going to be away from the bell, is going to help him drive a little bit of rotation in the upper thorax, which is going to make pressing overhead go much easier. But the thing that's going to stand out, folks, is the arm right here. Watch what happens. Boom. So he gets a little bit of rotation, but you'll notice he's got that arm stuck way out. Why is he doing that? Well, essentially what this is doing is it's allowing him to better engage the lats, which is actually going to limit his rotational capabilities throughout the rib cage. And so I don't want him to lock the lat in place as he presses overhead. And, I mean, Andy's moving some big weight here, no joke. So he's not going to have a bunch of rotation. And so that arm is actually going to help him stabilize that. But with this particular activity, that's not necessarily what I want. I want to encourage a little bit of rotation as he does this push press right here. Boom. So now let's contrast that with a version where he does allow that arm to relax, and we'll see the rotational difference. Now, folks, I did change a few things on this particular one. Namely, you'll notice now he's in a staggered position. This is going to promote a little bit of rotation. But then the other thing is Andy's going to keep his arm down right here, and you're going to see what happens when I do that. Boom. That looks pretty smooth right there. It's getting nice overhead action, getting some more rotation. You can see right at the end, he still wants to go back to moving the arm out, but I'm liking how this looks in comparison to the other moves, right? It's not perfect, but it's better. Again, we'll go ahead and check out the side-by-side comparison. I'm going to see if I can play both of these at the same time. Again, slightly different variations, but he's got way more head turn on the right one versus the left. So we look at, let's see if I can get, there we go. Boom. Check that out right there versus that. I like how that looks. It's actually getting a little side bend through the torso. Here, he's very flat and upright. And again, the stagger stance is going to help with that. But the head turn looks a lot smoother. He's got good arm position right here because the thorax is allowed to side bend. If we get some side bending happening, that's going to help promote some rotation with this particular move. And that's the story of Andy McCloy. If you have someone who's got reductions of movement overall and they exemplify a sway back orientation, you want to make sure to encourage them to push the hips back, move up and down vertically, and go ahead and move with very little tension and effort. And if you do that, a lot of times you can get some pretty quick movement improvements to occur. If you haven't already followed Andy, go ahead and give him a follow on Instagram at Andy McCloy _BCI. But otherwise, that's going to conclude today's case study. Did you find that useful? What struggles have you had with people who've presented similar to Andy? Go ahead, leave a comment below, let your boy know. And while you're here, go ahead, hit the like and subscribe button so we can keep the fam growing. And lastly, if you're struggling coaching your supreme clientele in this manner, you're not getting the results that you want, you're not getting the movements to look like Andy's afters, but you want to because you know that it's going to help enhance what you're going to get out of exercises, check out my seminar, Human Matrix. You can sign up for it at zachcouples.com/seminars. Again, there's 3 of them coming up. If you're watching this in 2022, May 7th and 8th in Buffalo, New York, May 28th and 29th in Seattle, Washington, and August 6th and 7th in Boston, Massachusetts. Thank you so much for tuning in. You've been an incredible, outstanding audience, and I hope that you keep it real but not to the extent where things go wrong. Stay hungry, stay learning, stay moving, and I'll see you next time. Deuces.